Koala. My name's Beth, and I'm a nurse here at the hospital.
Oh, hi.
How are you feeling today?
Yeah.
Are you a little anxious?
A little bit.
Okay. Well, if it's okay with you, I'd like to give you a little bit of information about your procedure.
Okay.
Would that be okay?
Yeah.
Okay. What you're going to have today is an angiogram where the doctor is going to look at the arteries in your heart.
Okay.
Arteries take the blood to the rest of our heart. Sometimes they narrow and the blood can't get through. And that's what causes us to have chest pain.
Gotcha.
Okay? So how they treat that when they get in there is they either put a balloon from that catheter that starts in your leg or your arm,
Mm-hmm.
and they go up into your heart and they blow up a little balloon that opens the artery up. And then they take the balloon out. But a lot of times they have to put in a stent, and the stent stays in,
Okay.
and it keeps the artery open. Okay?
I've heard of that.
So there's two different kinds of stents.
Oh.
Have you talked about that with your doctor at all?
No.
All right, well, let me give you a little bit of information so that you can have a conversation with your physician about it.
Okay.
Okay? So the two types are a drug-eluting stent and a bare metal stent. The drug-eluting stent has a drug coating on it that helps blood not stick to it. So sometimes after you have a stent, blood can stick to that stent and then the artery closes off again and you start having chest pain again. Okay? Both of these stents have very low risk of clotting off.
Oh, good.
Drug-eluting, about 5 people in 100 will have to come back in the next year.
Oh, well, that's not much.
Okay? The bare metal is about 9 people out of 100. So both low, but a little bit more.
A little more. Yeah.
What do you think about that?
Well, I sure don't want to have to come back again. I'm pretty anxious, and my husband had to get off work, and I just never take well to sedation. But
So coming back would cause you some more anxiety.
yeah.
All right, well, let's talk about some more information that might help you
Okay.
make a decision. So with each of these stents, there's a medication that you're going to have to take
Oh.
after the procedure.
More medication.
Yeah, 1 pill.
Okay. I'm already on a lot of pills.
Yeah,
It's not cheap,
it's not.
and I have all these side effects.
So you have a lot of medication right now, and you kind of have to worry about paying for
Yeah,
it.
I do.
Okay.
I just don't like medicine.
Well, the type of medicine this is it helps the stent keep those blood cells from sticking to it.
Okay.
So it's important. It helps keep it open.
Mm-hmm.
Okay. With the drug-eluting stent, you have to take this medication for a year,
Okay, but not forever.
not forever,
Just a year.
just a year.
Okay.
Okay. With the bare metal stent, you have to take it for a month.
Oh, that's even better. Just a month.
Yeah. Just
And then I'm done?
and then you're done.
Hmm.
Okay.
Okay. That
So-
sounds better.
Just a little bit more information about this medication is it can be costly.
Mm-hmm.
If you
They
have-
all are.
Yes, they are. Do you have medication coverage?
I do. It's not that great.
Okay. So with this medication, it can range for a year between 0, if you have good insurance, to about $2,500 to pay for it out of pocket completely.
Yeah, that's a lot.
So if you only have to take it for a month, then it could cost up to about $200.
Okay.
For
I
that
could probably swing that a little better than this. That's a lot of money.
So that money is kind of the cost of your medications is something that you want to be concerned about. Okay. So a couple other things to keep in mind when you talk to your physician about this is that if you're on this medication for a year, they don't want you to have any major surgery or dental work done because it can increase your risk for bleeding.
Oh. Well, I have this tooth thing planned for next month.
Oh, okay.
I think they might even pull it out. It's just not getting better.
Okay. Well, with the bare metal, you just have to wait for a month.
Okay.
So if that tooth has been bothering you, you might want to let the doctor know when you talk to him
Mhm.
and say,
So once that month is up, I can get that tooth
Yes.
out. There's no washout time for it to cut out of my system.
that's correct.
Okay.
Okay? Now, the side effects, and you talked about side effects being something that you're concerned about, are mostly the bleeding and bruising. So you'll bleed easier on this medication
Mhm.
than you will off of this medication.
So like internal bleeding or?
Well, it could be. It could be something as small as gums bleeding when you brush your teeth or having a little nosebleed.
Mm-hmm.
But it can be higher. Your risk of bleeding is very low.
Okay.
Okay? So taking all of this into consideration,
Mm-hmm.
what do you think?
Well, these side effects, I don't really care about a bruise. What's a bruise? Who cares? But, I got to get this tooth out. It's real, I decided I'm just going to take care of everything. We're going to do this catheterization. We're going to get the stent if we need. We're going to get this tooth taken care of, and then I'm going to be done. So I really like to get that done. I really you know, if I can stay off of medicine, that's my ultimate goal. I don't want to be on any medicine, so
So less medicine rather than more.
yes.
All right, well, when you speak with your physician, he'll come and talk to you before your case. You can mention that we had a conversation about this and talked about it, and that one of the things you were concerned about was that you have this tooth you need some work on.
Okay.
And then sometimes they need to put a drug-eluting stent in because of the artery and the way that it looks. But if they have a choice, you can talk to the doctor about,
Okay.
this might be yours because of your
Okay.
tooth.
Okay. So he'll decide, but if, you know, there is a choice.
Right.
And it's not obvious which one to put in, he can maybe choose what I like.
That's right.
Okay.
And just understand that your risk goes up a little bit with this one than it is with this, but not very much. They're both very low.
Yeah, there's still a lot of smiley faces.
A lot of smiley faces. Okay, do you have any more questions for me?
No, thanks for talking to
All right,
me.
you're welcome. Good luck today.
Thanks.